Fentanyl. Is it a miracle drug or a curse? What is fentanyl? It is an opiate which is derived from poppy plants. Some opiates are made directly from the plant, while others, like fentanyl, are made in a lab using the same chemical compound. Fentanyl is 50 times stronger than heroin and 100 times stronger than morphine. There are two types of fentanyl, which are pharmaceutical fentanyl and illicit fentanyl. It is a Schedule II narcotic under the U.S. Controlled Substance Act of 1970. A brief history. Fentanyl was developed by Dr. Paul Janssen in 1959 under a patent held by his company, Janssen Pharmaceutica. It was used as a pain reliever and anesthetic. In the 1960s, it was introduced as an intravenous anesthetic with the brand name Sublimace. In the 1990s, there was a fentanyl patch produced, and which was developed to help cancer patients with chronic pain. Most recently, Solace was developed, and this is a film that can be placed in the mouth that can help patients with pain. How is fentanyl used in medical settings? In medical settings, fentanyl is commonly used as a sedative for intubated patients. These patients are usually having surgery. It is also used in patients to treat severe renal failure or in patients who have developed a tolerance to opiates. While used for sedation, it is administered via a drip. Fentanyl can also be used to extend the treatment for epileptic patients. The use of fentanyl in the streets. Illicit fentanyl. This is distributed in powder and pills and in illegal drug markets. Illicit fentanyl is added to other drugs such as heroin, cocaine, methamphetamine, and MDMA. It takes very little fentanyl to create a high, which is why dealers mix it with other opiates. Many unsuspecting buyers may not realize their illicit drugs may contain fentanyl. This leads to many unintended overdoses. Fentanyl effects on the body and overdose. Effects on the body. Fentanyl binds to the body's opioid receptors. These receptors are in areas of the brain that control pain and emotion. Prolonged use causes the brain sensitivity to diminish. This makes it difficult to feel pleasure from anything besides taking the drug. During addiction, individuals are consumed with taking the drug. Some adverse effects are extreme happiness, drowsiness, nausea, constipation, sedation, problems breathing, and unconsciousness. Overdose. An overdose causes breathing to slow and stop. It decreases oxygen to the brain, causing hypoxia. Hypoxia leads to a coma, permanent brain damage, and even death. Naloxone is a life-saving medicine to treat fentanyl overdoses when given right away. The drug works by binding to opioid receptors and blocking the effects of the drug. Additional doses of naloxone may be needed since fentanyl is more potent than other drugs. This is a bonus YouTube short.
Since fentanyl kills about 136 people every day, you may be wondering, why are dealers mixing it with heroin, cocaine, meth, or prescription opioids if it keeps killing their customers? Because fentanyl is so strong, it's even more addictive. It creates intense euphoric and relaxing effects that makes other drug highs seem basic in comparison. Once used, everyday life feels numb. Like you can't feel anything at all. And the coming down from fentanyl is brutal, triggering intense body pain, diarrhea, and severe cravings for the drug. But now, the basic drug won't cut it, and it takes more and more fentanyl to feel its effects. So even though a whole bunch of people are dying every single day, the ease and intensity of the addiction keep people coming back, outpacing the loss of those who die from an overdose.